Hello, my name is Beth Linkowich, and I am the president of the Ontario Society of Occupational Therapists. I am so pleased to have this opportunity to speak to all of our members together and to share the excitement about our current strategic planning process. Over the past few months, we have been reaching out to you, our membership, to ask what is important to you about occupational therapy, our profession's role in the province, and how OSOT can most effectively advocate and support the profession. 3 big questions were posed online with a total of over 400 responses, augmented by over 50 interviews that our board directors conducted with members. After detailed review of all of the input, we identified 4 significant themes. Firstly, the profession of occupational therapy and the healthcare environments and systems that we work in are constrained and ever-changing. The second theme was that OSOT members want to be valued and respected as a key contributor to client health and well-being and to our health systems in Ontario. The third theme was that OSOT members want to be supported in continuing professional development, learning, and networking. And finally, OSOT members want to be better supported to do the best work they can. For example, we heard you want appropriate compensation and to be included in extended health insurance. On April 1st, the OSOT board and additional representatives from across the province met to create a strategy based on member feedback and needs. In this in-depth planning day, the group put forward a bold vision for the future of our profession in Ontario. We want to elevate our role supporting meaningful lives and healthy populations, and we want to assert that occupational therapy is an essential healthcare solution for Ontario. Our hope is that in 5 years, people across Ontario will understand that occupational therapy is necessary to ensure that people can age well at home, that children and adults with disabilities and complex needs can fully participate in their communities. We want to work so that occupational therapy will be recognized as a necessary resource in diverse environments ranging from hospitals, home and community care to schools, workplaces, and urban planning. We know occupational therapists can fulfill multiple roles in environmental and space design, coaching, care navigation and coordination, and should be funded through a blend of both private and public sources. Over the next 6 months, we will be reaching out to you again to gather your voices to help inform how we move forward. We believe that we need to focus in 4 areas to advance our vision. The first area of focus is that we need to increase the demand for occupational therapy in Ontario. To elevate the value and purpose of occupational therapy in the public domain by finding patient-centered ways of talking about the value of our work. We need to create an aggressive public campaign to build clarity about occupational therapy and assert a right to access. Secondly, we need to partner to build targeted evidence that improves practice and patient experience and demonstrates the value of occupational therapy. Thirdly, we need to support patients and families to access comprehensive occupational therapy by lobbying for extended health benefits and working with key health system players to advance access to occupational therapy. And finally, we need to engage you, our member community, as a force to advance occupational therapy in Ontario. In October of this year, we will be coming to your region on a roadshow, visiting 7 communities across the province to enable us to connect with as many members as possible. We want to discuss these priorities, gather your perspectives, and explore how to support all occupational therapists across this province to be advocates for our patients and for access to our expertise and services. We hope you will join us for one of these regional sessions and that you continue to engage with us virtually through our website. Stay tuned for more information. Thank you again for your input, passion, and commitment to advancing the health of our communities and asserting occupational therapy as an essential solution for our health system.